Dear friends and patients in all the countries where we travel and they travel to us for the surgeries that we do. Today I would like to talk for a few minutes regarding the childhood brain tumors. This is a different kind of a category because few people think that the childhood brain tumors may have a different kind of a surgeon available or a requirement may be a little different than a normal neurosurgeon, but that is not the fact. Pediatric neurosurgery is a part of neurosurgery, but pediatric neurosurgeons are extremely rare who take it only as that field as their target. So pediatric neurosurgery becomes a part of our routine practice. We keep on operating upon pediatric brain tumors. Now I would like to say a few things about it. Mostly brain tumors are one of the most common tumors in the pediatric age group, that means in young children, and at the age of 1 to 2, that is the time that most of them would have the first sign of the tumor. And the tumors are not similar to what they occur in adults. They are different kind of tumors, like brainstem gliomas are usually found only in children, and craniopharyngiomas are another kind of tumors which are found. Then there are two parts of brain, the supratentorial part and the infratentorial part. The childhood tumors are usually mainly found below the tentorium, the part of the brain which is the smaller part of the brain, the hind brain that we say. That is that's a common site of having a brain tumor in children. How would you come to know about that a child may be having a brain tumor? So maybe the child is excessively crying, or the child is very drowsy, is sleeping a lot. Maybe there is a squint, which is a new finding which was not there previously. Maybe there is a gaze palsy where the child has stopped looking in a particular direction and has a preference in one direction. There is a swallowing difficulty. The sound of the cry may be different. If the child is walking, the walk may become different. The patients may have more vomitings, they may have more headaches, and they may be lethargic in nature. So these are the few things that we should look at. Normally growing children in few tumors would usually have endocrine or the hormonal symptoms where the growth hormone is affected, and there may be early onset puberty. So these are the two common hormonal disturbances which occur because of these tumors. The treatment is usually surgical. So in such scenarios, how would you come to know? So MRI is the main investigation required because the CT scan may not show most of the details of the tumors. It is a standard thing for any kind of tumors. Then you may need CSF, that is the fluid of the brain may have to be tested for a few specific tests, and then your diagnosis is done. After the diagnosis is made, you will have to travel to, or you have to come to a neurosurgeon for the management. And if the management is surgery, then you have to be in a center where all the facilities for children, the pediatric population is there, particularly the ICUs, particularly the intensivists, the doctors looking after these patients around the time of the surgery, and particularly the post-surgery, have to be trained in that particular manner. The operating instruments have to be very precise. They have to be high-end, where you can operate without causing a neurological problem to the patient. So these are the few things that we have to look at. After the surgery is done, the target is to remove the tumor. If possible, to remove it completely. If it is not possible, which is common in this age group, then you remove it partly. And then followed as per the biopsy report of the tumor, we have to follow it with either radiotherapy. Rarely a chemotherapy is needed, but mainly radiotherapy is common. So that is where I would end. I don't want to be very specific and detailed. This was on request of a patient who has a relative suffering from a brain tumor, child pediatric age group. Thank you. See you soon. Thanks for your time. Take care. Bye bye.